Today we are here for the second webinar in the webinar series for the National Capacity Building Program for Patient Safety, and this is uh, uh, this is an series of webinars by the Patient Safety Secretariat with the support of patient safety nodal officers of the AIMS Patient Safety Network, wherein we have uh, around 24 topics all around the year. Every fortnight, we organize this webinar, and the different issues and aspects of patient safety are discussed by the experts from different aims. In the first webinar from AIMS New Delhi, the expert discussed upon the importance of the Department of Patient Safety in a tertiary care hospital. What are the requirements which need to be met, and how a patient safety department should be functioning, and what all things should be taken care of. So in continuation to this series, today the second webinar, we have the eminent experts from AIMS Bhopal, um, discussing upon the role of communication skills to improve patient safety. Our speaker is Colonel Dr. Ajit Kumar, DDA from AIMS Bhopal, and sir shall be discussing upon the various aspects of communication skill, the importance of communication in improving patient safety, and of course the outcomes in terms of patient satisfaction, patient care, uh, which are uh, which are required from any tertiary care hospital. With this, I would like to request Colonel Dr. Ajit Kumar to kindly take over and uh, help us through this deliberation. And after that, we'll have a small 4 or 5 minutes question answer sessions. Questions in the chat box, we shall discuss relevant questions. We will try to address them. Over to you, sir.
Thank you, Dr. Avinash. Am I audible to all?
Yes, sir, you're audible.
It's a pleasure to get an opportunity to speak to you all. I'm serving Army officer and presently on deputation to AIMS Bhopal. I have been associated with the field of psychology, and I have been doing soft skill training. So communication is one of the forte, which I time to time utilize to impart knowledge and education whenever I get an opportunity. So the present topic today is role of communication skill to improve patient outcome, patient safety rather. So I have in 10 minutes or so, whatever the time has been allotted to me, I have divided this topic in three parts. Firstly, I'll be telling you about what is communication, and thereafter I'll talk about patient safety, and third is how communication skill is going to ensure patient safety. So in these three broad categories, I'll be speaking for next 10 minutes or so. So what I'll do, I'll be sharing kind of a PPT, and we go along with the PPT together. Can you share? So as it is a well-known fact, and it is there on the view foil, that communication holds the world together, Vacham Viswasudharam. By way of communicating verbal, non-verbal, and written statements, we are bound together through the world. Several definitions could be there. One of them I'll read, that according to Peter Drucker, good communication is foundation stone for the administration. And so here it is more pertinent to the patient's safety, which you will come to know once I discuss particularly the third portion of this address. So, as why communication is important in healthcare? Because it provides high quality patient care, and moreover it ensures patient safety, and after all it culminates in healthcare outcomes. And communication not limited to conveying one person to another, rather it goes beyond, and how it is conveyed, understood, and acted upon by all the parties involved in the patient care, that is communication. So here today, we are focusing on communication among healthcare providers, between providers and patients, and within the healthcare system as a whole. So in this holistic manner, we will see how communication skill is going to enhance patient safety. So when I discuss about communication and several aspects of communication, so you will see that at every stage, I'll be talking about how it is related to patient safety. So this is a simple diagram, which is not very technical. Once you communicate, you transmit, and some sort of barrier or noise is there, and then it reaches to the receiver, from sender to receiver through a channel, and it is decoded and understood, and when it reaches to destination. So let's say, with the simple example, if I say I am not audible, so purposely I cuffed up, and if you say that I understood, communication is am I not audible, somebody may understand it as I am audible, because little bit of cuffing is there. This is a very simple childish example, but this could be one barrier. So effective and clear and precise communication is necessary to convey the message. So there are three aspects in communication, and broadly we generally know one is verbal communication. Verbal communication is basically the way we talk and face-to-face interaction on phone call, on virtual communications. So it has to be very clear and precise. Sometimes in healthcare setup, among healthcare professionals, we use a standardized language called SDAR for clarity, which enhances the patient safety. Second type of communication is non-verbal communication by way of gestures and eye contact and kind of a touch or pat could be a part of non-verbal communication, through which we build trust and empathy we show, and we also recognize patient cues, like in what kind of mood he or she is there and what kind of need somebody is having, a patient is having. So by that way, we ensure by non-verbal communication, a contact is established and we communicate message and we ensure patient safety. We can. Third could be a kind of communication is written communication through press note or prescription or progress note or proper documentation. We can share information about patient care, and it is conveyed across different shifts, team or healthcare setting. So the more accurate and legible it is, the nice way of communication it is. And in medical record, if it is there, so accurate, the more accurate it is, the more kind of patient safety is ensured. Sometimes it is in the form of EHRs, electronic health records, which helps streamlining communication by providing a surprise real-time source of patient information. So far, we have seen the verbal, non-verbal, and written communication. Sometimes we create kind of a patient-centered communication, which could be in the form of active listening. And why it is done? To understand the perspective, preference, and need of patient, to foster collaboration and trust. And sometimes it is for the informed decision also. So once doctor or let's say healthcare professional is talking a patient-centered is doing a patient-centered communication, so he or she is able to understand patient very well and bring and foster trust between healthcare professional and the patient. And it helps in making a shared decision making by effective communication. And it helps the patient to choose the best treatment plan, because the communication is patient-centered communication, and doctor also or healthcare professional also has freedom or understanding of patient's need. And this is kind of a communication, or it is called interdisciplinary team communication, where doctor, nurses, pharmacists, dietitians, social workers, they discuss some issue and they discuss a patient, let's say, or discuss a situation or surgery or anything. So for that, they create team huddles and rounds. Well, so what it ensures that regular communication resolves so many issues, like they exchange crucial information and they identify the potential issues, and coordination and care is enhanced. Sometimes roles are clarified once they are discussing. So more clarity of communication ensures kind of responsibility, and better patient care which ensures patient safety. Another kind of communication is high risk situation communication, where standard protocols are there. Like in our aims, we follow code red, code blue. That could be one kind of emergency situation when codes are set up, and to mitigate any situation in lesser time, we communicate with protocol. So for that, simulation training is required to ensure patient safety. So far we have seen that communication is verbal, non-verbal, written, interdisciplinary, and patient-oriented communication. As I told you at the very outset of the presentation, that I have divided in 3 parts. The first part is over, that is kind of communications or types of communication, and I'll be talking about now patient safety. What is patient safety? And then I'll dwell upon how the effective communication or communication skill can improve the patient safety. So what patient safety is? It is a critical component of healthcare quality which focuses on prevention of error, adverse event, and harm to the patient during the delivery of medical care. By that way, we ensure protecting patient from risk and creating system that healthcare provides offer a high standard of care in a safe, efficient, and effective manner. So we'll go ahead. Certain data is there, which is quite alarming. So this will highlight the need of patient safety in our healthcare system. I'll read some of, especially pertaining to India, like around 9.5% of the total population reported medication-related mistakes in India, while the treatable mortality rate stood up to 180 per 100K population in India, much higher than in the developed country. So you can imagine what kind of patient safety need we have and what kind of care we require in form of informed decision making regarding patient care, indicating need for proper patient safety protocol, which we should be having in all the hospitals. One more data I'll read, that 1 or 2, like 1 in 10 patients are harmed in healthcare. More pertinent to regarding to communication, patient safety indicates also impose an economic burden in high income countries. Up to 50% of the hospital expenditure is attributable to resource wastage following lapse of patient safety. Interestingly, over 50% patient harm is preventable and is attributable largely to medication error. So these kind of data is quite alarming, and that highlights the need of patient safety. And today we are discussing patient safety with a skill to improve, with a communication skill. So we go ahead. So one of the aspects of patient safety is prevention of medical error. So later on we will see how we can avoid this kind of medical errors through communication, but this is generally discussion of types only. So one of the type is medical error. Medical error is could be a diagnostic error, surgical error, procedural mistake, or error of omission when some necessary care is not provided. So this could be a medical error. And when RCA is done, RCA is to understand the underlying causes and develop strategies to prevent recurrence of such kind of mistakes which happen. So another is because of culture of safety. Patient safety is enhanced because of the culture of safety, because once you develop a culture of safety and you foster a kind of a belief in system, so people automatically report what kind of mistake, they feel safe to report mistakes, and they admit. Once they admit, the institute can learn from them and improve care process. So that culture of safety has to be fostered and incorporated so that the patient's safety is enhanced. So it is generally it is known to everybody, infection prevention and control. So patient is also prone to danger of infection, which is let's say some healthcare professional is infected during surgery or procedure. So preventing HAI, healthcare associated infection, will enhance further safety, patient safety. Hand hygiene is known, very widely known. Regular hand wash by healthcare professional and using personal protective equipment among the simplest yet most effective strategies to prevent and spread infection. So by that way, we can enhance patient safety. Antibiotic, the right kind of antibiotic and judicious use of antibiotic further will prevent infection and patient safety is enhanced. Medication safety, avoiding medication errors, which can happen during your prescribing medicine or dispensing. Let's say somebody dispenses wrong medicine, that is again adverse thing for patient safety. Or some strategies to reduce medical error includes electronic health records. So HR would be one kind of a barcode scanning could be another way to enhance patient safety. Medical reconciliation, when patient is admitted and transferred, so reconciliation will reduce the risk of omission. Patient education is one way to reduce the omission and enhance patient safety. But ultimately, we are coming to how communication skill is going to improve patient safety. Other patient safety related issue is patient identification and verification. Sometimes two patient identification rule, that is date of birth and name, that serves as a good method of enhancing patient safety. And then barcode and technology, new technologies have come to ensure patient safety. So that with technology we can enhance patient safety. Surgical procedure safety, by correct site surgery, by clear communication, we can direct the professionals to mark in advance the correct site, and wrong site surgery will further pose risk to the patient. So team briefing and huddles, again, I mentioned in the past also that pre-surgical briefing and timeouts as well as surgical team confirms procedural details, so that will enhance patient safety. Safe transition and handoffs, like once your shift is changing or you are transferring the patient from one doctor to another, or some miscommunication takes place, so that will enhance, that will reduce the patient safety. So that this patient safety is important aspect once safe transition during transitions. Now, the final part which we have dwelled upon so far, and today's topic is role of communication skill to improve patient safety. So now I highlight how communication skill can enhance patient safety. Firstly, if you communicate well, it prevents error. So once communicate well, once it is communicated well by somebody, by doctor or healthcare professionals, it helps prevent misunderstanding and could lead to minimizing medical errors. Could be if something is communicated well, wrong medication will not take place, incorrect doses will not happen, and delayed treatment will not happen. Somebody is in the place, let's say the urgency is there, and some miscommunication takes place. At that moment, the patient is at risk. So effective communication prevents error, and delayed treatment is debarred by effective communication. Wrong medication is debarred. So if you communicate effectively, it will improve overall outcome. So communication will lead to, let's say, doctor is communicating with patient, and if correct communication is made, the doctor or healthcare professional will be able to make correct diagnosis, and they will be able to make good treatment plans. And certainly, if diagnosis is well and treatment is done in a better manner, so it will lead to a better health outcomes. The third point is it will facilitate patient engagement. So once you are communicating well, you are empathetic and you are connected with the patient, good communication will ensure this. You will be able to understand patient condition well and treatment process well. Rather, communication will empower you and empower patient also. So in healthcare setup, the communication is the key. So it will really play an active role in care and reducing the likelihood of adverse events. So you can imagine that what kind of importance of communication is there in patient safety. So once we talk about improves continuity of care, when the patient is taken care of by multiple professionals and they are transferred between departments or facilities, so any miscommunication can lead to catastrophe. So to reduce that, effective communication and effective transition through communication has to take place, so that when the patient is transferred, he is or she is ensured that all team members know the patient condition, treatment needs, and any special consideration. So for improving continuity of care, the effective communication is the key. Let's say somebody is in the dire need of a treatment plan in the emergency situation. If you communicate well, the further deterioration is stopped, and patient's escalation to worse situation is again arrested. So quick response with faster intervention can take place with correct and effective communication or skillful communication. As I told earlier also, that the effective communication builds a culture of safety. People feel free to open up and transparency is ensured. Healthcare professionals feel comfortable voicing their concerns and reporting errors. If the communication is not there and you don't have a right way to connect with the healthcare professional, or let's say doctor or anybody, patient, they will not be able to open up. So mistake and refining processes are limited if you don't build a culture of safety through communication. So again, communication here, skillful communication will build a good kind of a protocol for patient safety. Let's say somebody is not native speaker, and let's say somebody from South is getting treated at Bhopal, and he or she is not aware about the Hindi language. So some kind of interpretive services has to be there to build an effective communication. So written translation and culturally sensitive communication can prevent errors and improve outcomes of non-native speakers. So this language could be a barrier. So barrier has to be identified, and the patient had to be treated in a nice manner, so that language barrier, or let's say any kind of misunderstanding, is reduced through effective communication. That will enhance patient safety. The example of non-native speaker is best way to understand this. It was discussed earlier also, builds a culture of safety. Because of the communication, you will be able to make and show a good leadership among healthcare professionals or anybody. So it creates a kind of a culture of safety where people are open and they create a good environment and create environment for patient safety. So it's repeating, I think. I think it's okay. So here I end my kind of presentation, and so far I have covered what is communication, what is patient safety, and how effective communication can lead to patient safety. Should you have any queries, you can ask me. I'll be able to reply.
Yes, sir. We are thankful for your expert micro detailing of the various aspects of communication with respect to establishing a culture of patient safety in any tertiary care hospital. And you have rightly pointed out that if you communicate well, it prevents error. And yes, the communication both ways it should be good. The health team interdisciplinary communication, wherein the health team, the doctor, nurses, and the other the technicians, every one of them communicates well. So that the importance of interdisciplinary communication you have highlighted, and how patient engagement is also very important in the patient outcomes. So with respect to the patient also, the communication should be such that the patient also feels engaged in his own care. And the other parts of the presentation wherein it was nice to note that yes, we need to have a strong patient safety sensitivity in our all tertiary care hospitals, seeing the fact that 50% of the resource wastage in hospitals is due to various issues of patient safety. So that is a huge amount, and if we are able to strengthen the patient safety culture in our hospitals, certainly patient satisfaction and patient outcomes is going to improve. Initial part of your presentation was regarding the verbal, non-verbal communication, and at the same time written communication also. So these are also the aspects which should be taken care of. While treating a patient or communicating things to a patient, we can have if generalized communication in such a way that we have IEC materials also in different parts of the hospital, so that when the patient comes to the hospital, from till the time the patient gets discharged or in the OPD, he is going out after taking the treatment. So he is aware of all the different do's and don'ts in the hospital, and how he should protect himself from hospital acquired infections as well, and how we should take care of the personal hygiene and cleanliness. And yes, we are also aware of the fact that patient safety is something which starts right from the point when the patient enters the hospital, and till the time the patient stays in the hospital. Motivating the patients to be equal partners in patient care, along with the health team, all of this is important for strengthening the patient safety. And I think we can take one question, maybe for the audience. Um, how can we communicate our errors to the key stakeholders, that is to improve ourselves and patient safety? Are there any protocols, or should we have any communication protocols devised for instilling the sense for addressing this particular component, sir? If you can advise us and enlighten us. If required, maybe we can have a SOP kind of a thing for communication strategy for patient safety in a hospital or something like that, like some.
So, in fact, that what I had pointed out, the safety culture you have to build in your hospital.
Yes,
By let's say, I have in the field of psychology, have been doing seminars and presentation abroad also.
yes,
So, what I feel that culture of safety has to be developed, where communication, people should feel free to speak. Like
yes,
adverse,
yes, yes,
my friend colleague is sitting here. He's telling that we at AIIMS Bhopal we have adverse drug reaction protocol is there, and people feel free to kind of express their concern, what happened, and regular feedback is taken with open communication, and there is a less fear of getting punished kind of a thing. So that kind of by head of institution, if such kind of things are fostered, so the culture of safety culture will develop, and that will ultimately enhance the patient safety through communication. What I mean to say.
yes, sir. Yes, sir. So I think we sir will keep you as our one of our experts whenever we need to have discussions on issues of patient safety. We are very thankful that you have joined for sharing your expertise on the topic, and we will continue to work together to develop capacity for patient safety across. And till the time, I think the next webinar we have this. The next webinar is on. I'll just check the calendar. The next webinar is by AIMS Nagpur. So on health records with respect to patient safety on 20th of November.
Yeah, 20th November it is.
Yeah, 20th November it is. So okay. So thank you so much. Thank you for the audience. We are thankful to the audience and of course the experts. Thank you. Thank you everyone.
Thank you, Dr. Avinash. Thank you very much. Good day.